talking to someone in the minutes before the breathing tube is going in and they're getting put on the ventilator and telling them, I don't know if or when, we'll be able to get you off.
The amount of emotional and physical stress is something I've never experienced in my life, even compared to a war zone.
This is obviously the worst thing that any of us have ever seen. Physicians and patients alike are going to be reliving this trauma for years to come.
We will go get care if we have coronavirus ourselves, but we will not go get care if we're depressed. We will get over coronavirus in weeks or days, physically. We will not get over the symptoms of the depression or the anxiety or the PTSD in days or weeks.
At home, I am not myself. And my wife is certainly trying to help me with that and be supportive while taking care of the 3 young kids. I have a much shorter temper than usual sometimes, especially with myself. It doesn't go away when you go home.
I have cried more than I have before while working in a hospital, whether it's in front of patients or while walking home.
I ran for 13 miles and I've never been that emotional, especially not when I'm running. And there were 2 points during that 2 hours of running when I was just bawling while I was running. And I didn't even know what it was about. There was just so much tension and that's just how it was coming out.
We're asking them to give up their time. We're asking them to put themselves at risk. So that is also physical risk. They don't have the proper equipment. I've seen people talk about having to intubate their friends.
It's so overwhelming. There is no break from COVID for us. I literally go to sleep and have all of my dreams are about COVID.
You just walk into a place, everybody looks like an alien in a spacesuit. You don't know who is who. And then when you interact with the patients, through gloves and you can touch them, but it's when you're smiling and all the facial expressions, whether it's sad or trying to empathize with their feeling, even trying to give words of comfort, just seems very fake and it's wasted because that interaction is just completely gone.
We see life and death all the time, but I think what's different now is the overwhelming number of people and how they get sick so fast. It really is unique, it really is different, and we feel powerless in a way.
There's also an access issue. It's not usually financial access, it's usually time. So when you need help, the time to be able to fit that in is really hard. There are a lot of barriers to telehealth that shouldn't exist in psychiatry. We have all sorts of laws that limit it, state-by-state laws. They make it so we can't see patients on the phone or using apps, and I have to have licensing in different states. And if those things were different, we really could see more people and people in rural areas. And when this is all over and we need to see everyone and we need to help people that don't have psychiatrists in their state, we really need to be thinking about ways to get people access, and telehealth is going to be one of them.
I think our attitude is and always will be that this pandemic is going to break us. It's going to break the doctors, the nurses, the respiratory therapists, the pharmacists, the EMTs. It's going to break us. But we won't let it break you.
Doctors are less likely to seek medical care and mental health care in general, but this is something that we all are going to be vulnerable to it, and we all have to accept it and seek care when we need to.
So after the crisis is over and as this winds down, there's going to need to be a centralized focus on the part of the government, both the federal and state governments, to help frontline workers cope with the trauma that they've experienced. They should have unrestricted access to counseling services and providers, whether it's face-to-face or whether it's through telehealth. Their access needs to not be restricted by things like deductibles and co-pays and caps. We need to make sure that whatever resources they need, that they're available to them after this pandemic's over.